The second brain, by now we've all learned this term. The second brain, our intestines, especially our large intestine. In the past, old medical knowledge introduced the intestine to us as just an organ for digestion, but we've realized that digestion is actually the least of what it does. It digested. The intestine actually plays a dominant role in a huge number of metabolic, hormonal, and neural processes. To give a small example, even our happiness is provided by the gut. 95% of the so-called happiness hormone, serotonin, which actually does a lot of things but is known as the happiness hormone, is synthesized in the gut. 50% of dopamine, the neuromediator responsible for pleasure and motivation, is synthesized in the gut. A lot of inflammation, materials, hormones, neural stimulation. In fact, the brain is the gut. These days, even people who have nothing to do with medicine have come to understand the importance of the gut from the media and popular information. So, isn't the gut important for our cats and dogs? Their gut health is at least as valuable as ours. What is gut health? There are a lot of in the gut. Microbes, bacteria, good bacteria. Not every bacterium is bad, by the way. We call the good bacteria probiotics, yeast, fungi, viruses. In other words, the gut has many guests, and we call this the microbiota. The balance of the microbiome is actually one of the most important parameters that keeps an organism's health stable. All of us. We've all witnessed this. When we go to a city we're not used to, when we experience a change in climate, we often have digestive issues. Why? Because we're not used to the local microbiome, the local bacteria there. So keeping the microbiome balance right in animals can, of course, first be achieved through good nutrition. In illnesses, during times of stress, and especially during seasonal changes, the microbiome balance gets disrupted. Sometimes the microbiome balance is already off. Because of diseases in the intestines, for example, due to inflammatory bowel disease, the balance is disturbed. In fact, even in cases of kidney failure, it's possible to prevent the body from being poisoned by uremic toxins, that is, toxins that should be eliminated by the kidneys but can't be, by using these probiotics. So which probiotic are we talking about? There are hundreds of types of probiotics. Bacteria are incredibly diverse. When we ask which probiotic, what we should really be thinking about is not so much which probiotic, but rather something else. How can this probiotic make it all the way to the large intestine in a healthy state? Because when we take a probiotic, let's remember the definition of a probiotic. What is a probiotic? They're good bacteria that have the potential to provide healthy benefits to the body. They need to have one more characteristic. They need to be able to adhere to the intestine. There's a long journey from the mouth to the large intestine for all of this to happen. First, there's an alkaline environment in the mouth. Then, when the acidic environment reaches the stomach, it's like a horror movie. Acid is coming from everywhere. Pancreatic enzymes and bile enzymes come into play. It needs to be able to pass into the small intestine, travel this long path, settle in the large intestine, and perform its functions. For this, our bacteria need to be very well coated. For cats and dogs. When we were designing a probiotic and conducting R&D studies, this was our priority. And that's why, after extensive R&D work, we developed double microencapsulation. In other words, this is an advanced drug delivery technology. It means that we have encapsulated each bacterium twice with microbeads. One of these protects against oxygen. One of them protects against effects like acid, alkali, heat, impact, and shock. When we talk about probiotics, pay attention. Let's remember, we defined it as live bacteria. Since it's alive, it needs to reach its destination without dying. We can only achieve this through protection. Double microencapsulation technology is not an easy technology. And for the first time in our country, we introduced this to animal health with Synbiocare. When we say live, just like any living thing, bacteria also need to be nourished. That's why when we add prebiotics, meaning the fibrous substances that serve as food for the bacteria, to the formulation, it's called a symbiotic. So we protect the bacteria from the struggle of finding food by providing it along with its nourishment, ensuring it remains preserved to perform its beneficial functions. We are able to deliver it all the way to the intestine. We have made it available for use especially during seasonal changes, periods of stress, illness, of course in gastrointestinal digestive system problems, and as an essential complementary part of treatment in liver and kidney diseases. When should we use probiotics? Preferably, we should use symbiotics. First of all, we absolutely must use them during illness, because in every illness, dysbiosis occurs, that is, the disruption of the gut microbiome, and the bacterial population shifts in an undesirable direction. So primarily during illness and for about 2 weeks after the illness ends, we should use them. Whether young or old. If we use them for all animals during seasonal transitions, we can also help prevent their immunity from dropping. We also eliminate the tendency for illness that comes with seasonal changes. So our second topic is seasonal transitions. Intestinal problems, diarrhea, constipation. At these points, of course, symbiotics are extremely beneficial. Además, pregnancies, postpartum periods, lactation periods. Actually, as someone who personally spends a lot of time in psychiatry, I can say this. With many of our patients who have anxiety disorders, we now continue treatment with just symbiotics. We completely discontinue antipsychotic medications. So, as I mentioned regarding anxiety disorders, since symbiotics trigger the release of happiness and health hormones, we can continue with them. Therefore, basically during illness processes, seasonal changes, and any kind of stressful situation, it should be used for at least 2 weeks. In kidney diseases, it has been scientifically proven that it helps reduce the formation of toxins excreted by the kidneys. In liver diseases as well, it should definitely be used for 2 more weeks after the illness process is over. Lastly, in geriatric animals, the composition of gut bacteria tends to change frequently, and usually for the worse. Based on my experience, even if the animal is healthy, using it during the first week of each month in a geriatric animal can make a significant contribution to maintaining the animal's health.